The start of a new school year is tricky enough in any year, isn't it, with all that rushing around getting kit? But this year, very, very challenging in the midst of a pandemic. And of course, having got them into school, parents and teachers have now been left very confused over government advice on what to do if there's COVID in the classroom.
Yeah, and with the lack of available testing, schools are having to take matters into their own hands. So is clearer government guidance needed, or does one rule not fit all? We have a panel of parents, teachers and experts to discuss this. But first, let's hear from some who are trying to get their heads around the rules.
I think it's one rule being told to us by the government, and then every single nursery that I've looked into have completely different rules.
If you could just get a test quickly, then you wouldn't really need to worry about it at all.
I personally have been sending the children in with a cold because they don't have a temperature, they don't have coronavirus, and if every time your child sneezed they weren't at school, they would never go. And after 6 months off, it's really important for me that they get as much education as possible.
Well, joining us now to discuss some of those thoughts is Dr. Mike Tildesley. He's on the children's subgroup of the Government SAGE Advisory Committee and is expert in disease modelling. We also have Karina White, mum of a 10-year-old, who says the rules are a mess. And also Paul Jackson, a primary school head teacher, and Paul Whiteman, the General Secretary of the National Association of Head Teachers. So people have seen it from all sides this morning. Let's come to you, first of all, Karina, as the mum. You say it's a mess. Would a universal rule for the whole of the UK, would that have helped you? What's been your experience?
At my daughter's school, they've actually been quite understanding on parents' individual situations and also the situation that's going on across the UK. We are heading into a time where it's cold and flu season. You know, kids are the ones who are notorious for carrying cold and flu viruses. So what they have said is if they have a persistent cough or they have a temperature that has gone on for a few days, then the children need to stay off of school until if it's after 2-3 days and they're getting better, then they can come back into school. They do have a few tests at school, so they have been giving them to parents whose children are showing symptoms of coronavirus and then waiting for those test results to come back. If they come back and they're negative, then the children are allowed into school. If they come back and it's positive, the whole of that year group, there are one formentary schools, the whole of the year group, plus the class teachers, plus the TAs have to stay off of school. But I don't think one rule would work universally. I think schools need more support from the government in making these decisions about what to do. Teachers and schools, they're not medical professionals, and this is something completely new that no one's experienced before.
Not to interrupt you, Karina, why do you say it's a mess then? Why do you say it's confusing if actually your school is being quite clear?
So I'm co-host of the Don't Black Mums podcast. So we have a community of mums from all over the UK and all over London. And what they have been saying is that it's completely different advice that they've been given to their schools. If their children are coming in with a runny nose or a cough, they've been told that they have to stay off of school. And if they've got siblings, then their siblings have to stay off of school. And these are mums who are, some of them are teachers, some of them are key workers. So that then means that they've got to then stay home to look after their children when really it could just be that they have a cold, which is normal for this time of year.
Paul Jackson, you're a head teacher of a primary school, so on the flip side, you must be getting bombarded with parents coming to you for advice, not just any old advice, but medical advice. And do you feel confident that you can actually do this and know that you're making the right decision?
I mean, there's a degree of confidence in the fact that as an experienced head teacher, then we're following the advice that we're given, but I'm not a medical professional by any means. So we're doing our very, very best. But there are dilemmas. We've got some children that are presenting with symptoms. So we're asking them to stay off school. But it is hard to distinguish between what an actual COVID symptom is and what would be something that would just be, as Karina said, kind of a run-of-the-mill cold or flu-like symptoms. What we're saying to parents is if it's a cold, if it's a runny nose and you would have sent your child to school pre-COVID, then still send them to school now. But there's a degree of frustration from some of our parents in that when we're asking children to isolate, and obviously it has a huge impact on their lives as well.
So would a universal rule help then? So you were very clear, we have these symptoms, what we do is send the child home, or what we do is send the class home, or what we do is send the year home. Would that make life easier to administrate for the youngsters? Because, you know, otherwise, as you say, you're not a medical profession, you have to make the decision.
I only wish it were as simple as that. And if we could all have universal rules, it would make my life a lot less stressful. But I think the challenge is every school is different. As Karina says, her children go to a school that's a one-form entry with 30 children in each year group. We're a much larger school. We've got 750 children here in a primary with 90 children in each year group. And a decision made in Karina's children's school would be very different to the decision made in my school. And I think that what we need to do is just to know that we've got the support locally and nationally, that the decisions that our school leaders make are supported by the community and centrally. What we know is that if there's a case here, I'll phone the helpline, we'll work through a risk assessment, as would any other head teacher, and assess whether it were an individual year group, whether it were an individual class, whether it was particular children that we would isolate, and so on. What we want really is for some of the pressure to be lifted off us, knowing that we've got Ofsted still breathing down our neck, the health and safety executive breathing down our neck. We want some freedom as head teachers to be able to make the right decisions and take some of that pressure off.
So, Paul Whiteman, you're General Secretary of the National Association of Head Teachers. I know you've had lots and lots of emails, nearly 300 from your members on testing alone. Are they all craving clarity and saying they would like a universal rule, or, you know, as we just heard there, more autonomy individually?
So Paul and Karina are both right in that a universal rule probably won't work. Every school is different, and you're talking about schools of one-form entry primary schools right the way through to huge secondary schools, and their circumstances are very different. What school leaders, teachers need, and what parents need as well, is very quick access to clinical advice and very quick access to testing. The difficulties that we've had so far, it's clear that school leaders should go to their local public health teams before the new central helpline was introduced, and they were simply overwhelmed, and that's where all the confusion came in. But where symptoms are seen, children and adults in the school community need to be tested quickly so that we can get children back to school and we can get teachers back to school very quickly as well. I'd like to add a message of thanks to parents, actually. Parents, all the school leaders that I represent, are telling me that parents are frustrated with the lack of government clarity and government advice and support to schools, but very supportive of what schools are doing. And I think their patience and forbearance has helped schools get back. And I think the country can be very proud of what schools have done in the face of very confused advice from the moment we restricted access way back in March to the full opening. They've delivered time and time again. But what we need to carry that on to make sure that the return remains secure and safe is access to clinical advice very quickly. As Paul was saying, school leaders aren't clinicians. They don't have that level of expertise, but they do carry a significant health and safety responsibility. So they need the experts to advise them. And if we need someone tested, we need that to happen quickly and the results to come through just as quickly.
Well, Paul, heard the message loud and clear. Let's bring in Dr. Hillary. I mean, Dr. Hillary, you've got that medical advice. How essential is it that schools have access to it immediately?
Yeah, it's important that they have access to a helpline and good advice. What we do know is that in Scotland, for example, 17,000 children were tested, two positive tests out of 17,000. So most coughs and colds, sniffles and splutters are completely normal for this time of year. So we don't need whole swathes of children off school. If a child has a new, dry, continuous cough, which is totally different to the one that parents normally see at this time of year, if it's persistent, spasms of coughing 3 or 4 times in a 24-hour period, or maybe coughing every couple of minutes for an hour, then that's different, especially if it's accompanied by fever, loss of appetite and a rash. But if those things aren't present, take your child home, see how things go. If they haven't got a fever, they haven't got any of those symptoms, they'll probably go back without a test in a day or two. But speak to the head teacher, and if everyone's singing from the same hymn sheet, that's fine. But all schools are different, and we've heard there's some very sensible, a sensible range of advice for parents, and
Yeah.
hopefully they won't panic too much and realise that actually the prevalence in schools is pretty low.
And we're back to the testing again, aren't we, Hilary? That's the problem. And also advice. Let's speak to Dr Mike Tildesley, who's on the children's subgroup of the government's SAGE Advisory Committee. And, of course, he's an expert in disease modelling. We heard Baroness Dido Harding seem to imply that actually the surge since schools have got back, they hadn't predicted, and almost seemed to be implying that they hadn't got the advice from SAGE on that they, you know, could have done with and needed. And now we're hearing, aren't we, that we may have to go into this half-term 2-week lockdown. Do you think that's likely? And is that what you're advising when you're giving the schools this kind of advice?
Well, I mean, the first thing I should say, I want to echo Paul's comments here regarding the work that schools have done. I think all the schools have done a huge amount of work to try to make them as safe as possible. That's the really key thing. In terms of the cases we've seen in schools so far, it's really important to remember that COVID, the incubation period of the disease is quite long, up to 2 weeks. And actually, the cases that we're seeing in schools now were most likely, in the vast majority of cases, infected before schools reopened. And so whilst we are seeing cases in schools, in the vast majority of cases, this is not evidence that we are seeing spread within schools. If we start to see spread within schools, then obviously that's more of a concern. We would say that the risk around schools is still relatively low. The challenge, of course, is that schools have reopened after a wave of other relaxation measures that have happened throughout the summer. So when schools reopen, we might expect the R number to increase slightly, but we would see potentially the effect because when schools opened, a lot of the work that we were doing still suggested that R was already approaching or slightly above 1. So my concern is that schools sort of, in inverted commas, get the blame for R rising above 1, whereas in fact, we've already been mixing a lot more. In terms of your question regarding a potential lockdown in the future, it is certainly one of the things that might be considered. I would say that many people would consider this very much a last resort. We are seeing local lockdowns increasing across the country. And if that pattern of behaviour continues, we may be in a situation where we almost are in a national lockdown by another name because we have so many local lockdowns. This kind of circuit breaker idea would allow us potentially to lock down for a short period of time and sort of reset, essentially. So we could buy ourselves some time, reduce the infection and potentially, hopefully, reduce the risk of a really large surge of infections as we approach the Christmas period.
Well, OK, I hope that you're right, that we can avoid it, because I think people, for many different reasons, would like to, wouldn't they? But good to speak to all of you this morning. Good to speak to you.